I'm Patricia and I'm coming to you from Hospital Manager Asia 2015 in Yangon, Myanmar. Today we're with Miss Patricia Williams from GHSN. Hi, Miss Williams. It's nice to meet you.
Nice to meet you too.
I hope you're enjoying your day so far.
Very much. Thank you. I'm looking forward to the rest of the week.
Yes, it sounds very exciting already. So to start off, if it's okay with you, if you could give us a short background or a clue about GHSN.
Oh, thank you. I'd love to. GHSN stands for Global Health Services Network. We're an organization that is a U.S. company but focuses on international healthcare development and management efforts. So we work with hospitals and ministries of health and other healthcare organizations, mostly in Asia and Africa, but also in the Middle East a little bit, to help them improve their services. And there's three areas that we focus on. One is efficiency, the second is quality of care, and then the third is the patient experience. So we do that through training programs, through management of hospitals, and through consulting.
It's the first time I've heard of an organization that works with Africa, Middle East, on this kind of topics.
Yes, we've worked in over 60 countries actually. Our team members have had experience in over 60.
That's really cool. So I would like to ask you, what kind of training do you think hospitals should give their staff so that they are prepared for the future?
I think that's a great question because at the end of the day, healthcare is about people taking care of other people and taking care of people who are at their most vulnerable. So I think it's really important that we focus not just on the technical skills that are needed to take care of people, but also on taking care of people with respect and with dignity and having good communication skills. Because most people, when they're in hospitals, they're sick or they have a family member that is sick and they're afraid and they don't know what's happening. So I think communication skills are very important. In addition to the technical skills, I think practical training, not just book knowledge, but how you apply the book knowledge that you learn in a practical setting is also very important. And interdisciplinary training, I think, will grow also in importance, so that healthcare professionals and hospital professionals can learn more about how they work as a team to take care of the patient. And I think that's an area that's going to be very important and continue to grow in the future.
You noted that hospitals need communication skills.
Yes.
I think that's very true. Like that's the most I look for when we go to clinics and hospitals.
Yes.
Because sometimes it gets very stressful when you don't understand the person, or when the doctor doesn't seem to understand the patient.
Yes.
It's very a mess.
And you can have the best technical, skilled surgeon or nurse that's very good at what she does, but if they can't communicate with you and help you understand what's happening and what you need to do to take care of yourself also, then it limits your experience and can be frightening too.
Yes. Since you already mentioned about your organization, what services does your organization provide to other hospitals?
Well, as I mentioned, we really want to partner with hospitals. So we really want to support their efforts. So we try to really learn about what some of their challenges are and also what some of their strengths are and how can we help them overcome their challenges and help them also strengthen what they're already doing very well. And so we do that by mentoring, having people who from our team can spend time at their hospital and work with their staff like coaches and mentors, or can do training programs, specific workshops and training programs of that nature. Or again, as I mentioned, we can actually manage a hospital or manage a department of a hospital. We also have seen a lot of private hospitals developing in recent years. And one of the things that we really love to do is work with the owners and investors to help them make sure that the hospital they're planning is the right size hospital, the right type of hospital that will really meet the needs of their community. So we do a lot of planning work with private organizations also.
Seems like that would be very perfect in this country.
There's a lot of need for it because you spend a lot of money on the capital expense, the building and the equipment. And so if there's a way to make that as efficient as possible and not waste money, then that's a very important activity also.
I think it's a very useful organization, especially
Thank you.
around Asia and countries with very limited healthcare access.
We love what we do, so
Yeah,
it's always
it
fun.
seems very super interesting. So, since you are a partner of HMA this year, besides being a partner of HMA, what reason do you like attending HMA?
Well, we really enjoyed. This is the 4th year that we've had staff participate, and it's a really well organized conference. So we appreciate that and how it's organized and the level of communication that the staff has. The sessions are always very interesting, and the networking is always very interesting. There's such a wide variety of people here from different types of organizations in different countries. So it's a wonderful opportunity to meet people with a common goal and make new friends and learn more also about what is happening in healthcare in Asia.
I hope you're enjoying your stay in Yangon, and that's all the questions I have for you today. Thank you very much for your time.
Thank you.
Yes,
It was a pleasure.
so thank you very much. Thank you.